Hello, I'm Dr. Flores. I am one of the fertility specialists here at San Diego Fertility Center. Today I wanted to talk about recurrent pregnancy loss, what it is, and what treatment options are available once we make that diagnosis. Recurrent pregnancy loss is defined as two or more pregnancy losses that can occur in an individual, which we know can be extremely devastating. It's not that it's infertility, but it's still just as stress inducing and can even be emotionally so challenging because you were able to get pregnant, but unfortunately the pregnancy did not progress. And so we really want to work to, one, explain what recurrent pregnancy loss is and what we do in terms of trying to work up potential known causes, but equally importantly, letting you know that with respect to those pregnancy losses, nothing that you did caused that loss. A lot of times patients start thinking about a medication they did or didn't take, exercise that they did or didn't do, maybe a prenatal vitamin they did or didn't take. And I just want to really emphasize the fact that nothing you did caused the loss. We do know that there are some known factors that can contribute to recurrent pregnancy loss, but that's part of how we evaluate it and ultimately decide to treat you. So the biggest thing that I want patients to take away again is that nothing that you did caused the losses. But now that we know that you've had two pregnancy losses, we really want to work to identify any potential cause. And then even if a cause is not found, really focusing on ways that we optimize your likelihood of not just getting pregnant, but staying pregnant and having a live birth. So when we think about recurrent pregnancy loss, there are various factors that we want to look at in terms of what can cause that. These include hormonal factors, genetic factors, and also certain antibody conditions as well. When we think about the hormonal aspects, some of the things that we'll check is a prolactin and a thyroid hormone. Prolactin is a hormone that's made by the brain, and normally it increases in preparation for lactation or breastfeeding. But sometimes it can be elevated outside of pregnancy or outside of breastfeeding. And that we want to know because it can interfere with the ability of an embryo to implant or implant successfully. If we do encounter that, there is a treatment for it. It's called cabergoline. And what that does is it brings the prolactin back down to normal levels. Another hormone that we'll be checking is thyroid hormone. It stands for thyroid stimulating hormone, TSH. That is a hormone that is involved in energy metabolism. And so if your thyroid stimulating hormone is elevated, that means that the thyroid is having a little bit of trouble of carrying out its normal functions. Again, if we encounter that, we also will prescribe you a medication to help bring your thyroid hormone into a normal level. Another test that we'll look at is something called a hemoglobin A1C. That's really looking for whether or not patients are at risk of or who are newly diagnosed with diabetes. Having a good control of your blood sugar will also help optimize not just, again, getting pregnant, but staying pregnant. And if that is elevated or if that shows that you have diabetes, we'll work with you along with an endocrinologist and your primary care doctor to make sure we have your blood sugar in a good range. Some of the other tests that we're looking at are genetic. So we do know that there can be some chromosomal issues that can contribute to recurrent pregnancy loss. So this would involve a test looking at both your chromosomal makeup and in individuals who have a male partner, their chromosomal makeup. And what we're looking for is in women, the set of chromosomes should be 46XX. In men, it's 46XY, the Y chromosome indicating male origin. But sometimes individuals can have two chromosomes that are really not supposed to be right next to each other. They can be right on top of each other. We call that a balanced translocation. For you as an individual, because it's balanced, it wouldn't have an effect on you. But when those chromosomes try to ultimately combine, or when the egg and the sperm ultimately combine, sometimes those chromosomes can become unbalanced, and that can contribute to miscarriages. If we encounter that, then what we'd recommend at that point is doing IVF, because there we can ultimately biopsy the embryos so that we can also identify if any of the embryos have the unbalanced form, which puts them at risk of ultimately not implanting or implanting and leading to a miscarriage, or if they're balanced or not affected. And those embryos should not have any negative effect in terms of they do have a normal ability to implant and lead to a normal pregnancy. And the last two tests that I wanted to talk about, one is called antiphospholipid antibody screening. So it's a long term, but really it's looking at 3 different antibodies. They're called beta-2 glycoprotein, anticardiolipin antibody, and also lupus anticoagulant. So these are some antibodies that when they are elevated, they can make it harder for an embryo to stay and implant, because they essentially try to attack a developing embryo. And again, if this is encountered, it is treatable. We would talk about starting you on a low dose aspirin medication and also a medication called Lovenox, which is a blood thinner. And those 2 medications together work to really decrease any inflammation or any consequences of having those antibodies present. The last test is doing an ultrasound, because sometimes individuals can have a little bit of a uterine anomaly. And what that means is there can be something structurally a little bit different about your uterus that can make it a little bit harder, again, for an embryo to implant and ultimately lead to a normal pregnancy. Really, the big one that we're looking at is something called a uterine septum. So it's a fibrous band that can be present in the uterus. It doesn't have a great blood supply. And so you can imagine the embryo requires a really good blood supply to grow and ultimately lead to a normal or a healthy pregnancy. And so if that embryo tries to implant on that fibrous tissue, it's unfortunately not a great blood supply for the embryo, which can lead to a miscarriage. Again, if we find that treatable, we would talk about doing a surgery. It's called a hysteroscopy, where it's almost like a little telescope that goes through the cervix into the uterus, and then we're able to remove that fibrous tissue. Now, sometimes we don't find a reason, and that can be equally devastating, because you're coming wanting a diagnosis, and sometimes we don't find that there's any abnormality. Your prolactin's normal, your thyroid levels your thyroid stimulating hormone levels are normal, the uterus looks normal, and you don't have those antiphospholipid antibodies or any chromosomal abnormalities. Now, I do want you to know that just because there isn't a reason does not mean that we cannot treat you and ultimately help you have a healthy pregnancy. There are still things that we can do to optimize your likelihood of not only getting pregnant, but reducing the risk of a miscarriage so you go on to have a live birth. And the one thing that I really want to emphasize is that studies have been done in patients who've had several miscarriages. Not that we would ever want you to have more than the 2 that you've unfortunately already had, but I bring that up just to let you know that there is still over a 70% likelihood of pregnancy, even in individuals who've had several miscarriages. But there are things that we'll do to try to optimize, again, minimizing that risk even further of a miscarriage. One of them involves using baby aspirin, or a low-dose aspirin, 81 milligrams. There have been studies looking at whether or not that is involved in decreasing the risk of miscarriage, and it has been found that in individuals who've had a history of recurrent pregnancy loss, who took a low-dose aspirin every day throughout pregnancy, did have a lower risk of miscarriage. So that's one way that we can help minimize the risk of a miscarriage. Another medication we may add on is progesterone. Progesterone is very important for implantation and for helping to maintain a pregnancy. Those studies have been a little less clear in terms of how much of a benefit, but essentially the goal is that after ovulation, we start you on a supplemental vaginal progesterone, again to help optimize the likelihood that not only will the embryo implant, but that it will go on to lead to a successful live birth. So sometimes for patients who have recurrent pregnancy loss, if everything comes back completely normal, then we can go ahead and say, let's start by trying the baby aspirin and the vaginal progesterone. However, we recognize that it still is extremely daunting to think about whether or not there are other ways that we can further minimize the risk. And so another thing that we can talk about is in vitro fertilization. Because many times, unfortunately, even though your chromosomes can be normal in terms of male and female chromosomes, sometimes there's still an incorrect number of chromosomes in the embryo, and that can also lead to miscarriage. And so where IVF can become helpful is we would ultimately test the embryos that are created from IVF so we can know ahead of time whether or not the chromosomes are normal. And so that will provide some additional reassurance that, again, the embryo that we're placing back inside is chromosomally normal, so should hopefully have a higher likelihood of not just implanting, but leading to a live birth.